Hello, my name is Gallagher. I'm a plastic and reconstructive surgeon based in Indianapolis, Indiana. So today I'm answering a question I get a lot from patients, and that's for the double incision with free nipple graft, or as we like to call it, masculoplasty surgery. Where is my scar going to be, or do I get to choose how high or low my scar is? So as much as possible, I understand as a plastic surgeon, it's your chest, and I really always try and deliver the result you want. Usually the best way to do that is with photographs. So oftentimes in the office we look at other patients' results. I always say the best way to predict your result is to find yourself or somebody close to yourself in the pre-photographs and see what their post looks like, and unless you tell me otherwise, that is often going to be your result. With a lot of guys, we are usually asked to give the most natural and non-operated look as possible. So that's usually what I'm striving towards, but I am always absolutely open to hearing what the patient wants. And usually, like I said, the best way to communicate that is through photographs. So with regards scar placement in top surgery, it's hugely important, because really what we're trying to do, if you think about it, is create the optical illusion, or really try and hide that scar underneath where your pec muscle inserts. So it looks like just the natural crease underneath the pec muscle, if at all possible. So there's a few things we know in order to make that happen. We know where that lives, and usually it's about 1 centimeter, maybe 2 centimeters above the natural fold underneath the breast. So usually we're trying to shift things around a little bit to have it fall within that fold. So in some patients it's difficult to do this. I would say particularly in very large patients or patients who've lost a lot of weight, because that anatomy can be a little bit off. And if you think about it, we do have to place the incisions where we're removing tissue. So obviously we can't put the incisions very far from that tissue that needs to go. So we are somewhat stuck from that point of view, in that your scars obviously have to be within a centimeter or two of where the tissue is we're removing. But I always love to hear what a patient has in mind, and we try to put our heads together and achieve that as much as possible. Same thing goes for whether or not you get 2 individual scars or 1 scar straight across the chest. Vast majority of patients we can do your surgery with 2 different scars, but again, in some patients, and really the best way to figure out if this is you, in some patients we need to bring the scar all the way across. Oftentimes we'll kind of do 2 little curves, or kind of the gull wing, they call it, type incision. So again, it looks as natural as possible. But what we don't want to do is, if you look in the mirror and you see that you have a lump of tissue there, or the breasts are very, very close together, we absolutely do not want to leave a lump of tissue left behind, because scars will fade and get better with time, but that lump of tissue isn't going anywhere. So therefore, often, or sometimes, we'll find the need to join the scars in the middle. Again, this is a conversation you have to have with your plastic surgeon beforehand. It's your surgery, it's your body. So all of these are fantastic questions, and it's oftentimes very useful to maybe bring pictures along with you, what you do and don't want, to make sure that everybody's on the same page before undergoing this very important surgery.